For my presentation, I'm going to be talking about the impact of race on the prevalence and prevention of breast cancer for African American women. The learning objectives for this presentation include identifying the characteristics and demographics of African Americans, understanding how this health disparity affects African American women, recognizing the factors and determinants that affect health for this population, identifying the needs and considerations for African American women, and also identifying effective interventions. There are 41.4 million African Americans in the United States, which makes up approximately 12.7% of the population. A large portion of these African Americans live in southern states such as Texas, Louisiana, Florida. Only around 86% of non-Hispanic Blacks earned a high school diploma compared to 92.9% of non-Hispanic whites. And this trend continues throughout higher education as well. The median household income for African Americans is approximately $40,000 compared to over $65,000 for non-Hispanic whites. Okay, so this graph shows how African American population has increased throughout the last 10 years, and also how it's projected to increase throughout the next few decades as well. Now I'm going to talk about the impacts of breast cancer in this population. African American women are more likely to be diagnosed with aggressive forms of breast cancer. African American women have 40 to 70% higher risk of stage 4 breast cancer across all four subtypes. And not only are they more likely to be diagnosed with more aggressive breast cancer, they are also less likely to receive recommended treatment regimens and are more likely to have worse survival outcomes. So when the breast cancer is detected at an early stage, African American patients are also more likely to receive inappropriate primary treatment following breast cancer diagnosis. This is another graph that shows the differences in breast cancer mortality among different races and ethnicities. And as you can see, African American women have a higher mortality rate than all the other races and ethnicities shown on this graph. There are many risk factors and social determinants that affect health in the African American population. But for this presentation, I'm only going to focus on lack of insurance, unemployment, poverty, and lack of transportation. So 9.9% of non-Hispanic Blacks in comparison to 5.9% of non-Hispanic whites are uninsured. As of February 2016, unemployment rates were twice as high for Blacks than whites. African Americans are also the poorest ethnic group in the United States, and this poverty is correlated with poor health outcomes and increased morbidity and mortality. African Americans often live in poor communities where transportation is a problem. So this is a barrier that prevents this population from getting the healthcare that they require, especially preventative care and early detection, which is very important for breast cancer. The African American population lacks trust in healthcare and physicians. When compared to white individuals, African Americans report higher levels of healthcare system distrust. And this distrust is also associated with lower rates of recommended disease prevention and treatment of acute and chronic illness. Discrimination is also a big issue among African Americans. About 80% reported at least one incident of racial discrimination when compared to only 34% of white individuals. The mistrust and discrimination in healthcare results in African Americans not utilizing professional healthcare. Instead, many African Americans rely on religious counseling and coping for both mental and physical health. There are several effective interventions available to reduce this health disparity among African American women. There is significant evidence that suggests that there's a correlation between behavioral, educational, and psychosocial interventions in breast cancer screening behavior. Messages that are tailored to connect with African American women on a cultural, racial, ethnic, and cognitive level appeared to increase follow-up screening when compared to messages that targeted the African American population. Lay health workers work to promote health by increasing breast cancer awareness, promoting early detection, and increasing mammography screening among African American women. This is very important because the increased breast cancer screens could result in more early detections, and that could decrease the likelihood of mortality. So now I just have a few key points that were throughout the presentation. So African American women are more likely to be diagnosed with late-stage breast cancer and have worse survival outcomes. Lack of insurance, lack of education, unemployment, poverty, and lack of transportation are all risk factors that lead to this disparity. Behavioral, educational, and psychosocial interventions, tailored messages, and lay health workers are effective interventions that increase mammography screens among African American women. And these are the references I used throughout my presentation.